This is a perfect example of inflammatory hair loss, and he ended up regrowing the vast majority of his hair in just 90 days. Hi, my name is William Gonitz. I'm the founder and CEO of Evolution Hair Loss Institute. I'm a fellow with the World Trichology Society, and I've been helping people regrow hair for over 21 years. This particular case is another phenomenal case as an example of what can happen when you treat the cause correctly. And when we get to the end of this video, I'm going to give you some more further details on inflammatory hair loss and what you can do about it. But I really want to get into the meat of this case. So he was in his early 40s when he came in. This gentleman was actually very well versed in taking care of his body because he is a chiropractor. This gentleman had two different reasons for hair loss. He originally started out with DHT related hair loss on the top of his head, but he ended up losing a tremendous amount of hair, if not almost all of his hair, in a very short period of time due to inflammatory hair loss. And when he ended up going through this process, he had gone to multiple physicians, he had gone through a series of different protocols with no results, and really was at his wit's end because he did not know what was going on. After going through a patient history and really understanding what was going on with his situation, it turned out that he had started a supplement approximately 3 to 4 months prior to the onset of his loss. So he ended up losing all of this hair in just 1 calendar year. It seemed like, based on the patient history, that it was directly related to the supplement that he had begun about 3 to 4 months prior to the onset of the loss. We were able to identify not only from the way that his scalp looked, because the back of his scalp, when you're looking at that under the microscope, was extremely dilated. There was a lot of redness, there was a lot of inflammation, there was a lot of capillary dilation, and there were also pustules on the surface of his scalp that also indicated that inflammation was at play. In the areas of loss on the top of his head, it was very standard male pattern DHT related loss, but he really was worried about the overall volume of loss that was continuing to fall out due to that inflammatory hair loss. So after we identified the reason, we then really looked at how are we going to rehabilitate this situation. And when we are dealing with an inflammatory reason like this, if you can find the cause, then you want to eliminate it as effectively as possible. And there can be all sorts of different triggers. In this case, there was a nutritional supplement, but I have seen environmental allergies that are actually exposed to somebody in the air that are problematic for inflammatory hair loss. I've seen medications. I've also seen stressors, like emotional stressors, that are actually causing the loss, and even topical applications and chemical processing. I've seen women who are actually allergic to hair coloring, and that caused their hair loss every 3 to 4 months when they did a permanent color. I've also seen females who are getting chemical processing like relaxers or even Brazilian blowouts. And those types of scenarios, the chemicals were causing allergies that were in turn leading to inflammatory hair loss. So if you can remove those from the environment, bring down your stress, do whatever you possibly can to initiate the rehabilitation from the inflammation, then you are going to be able to be successful. So I recommended that he went off of that nutritional supplement. We also ate right for his blood type, and we dove into his particular protocol, which I had identified would be an inflammatory protocol and obviously a stimulative protocol with low-level laser therapy. So he ended up having twice weekly laser sessions, actually very low intensity, about 15 minutes on a 30 diode setting. And then he also was shampooing his hair more aggressively because that was something that he had stopped doing because he was concerned that his hair was falling out. And then we also ended up using the essential fatty acid supplement to help bring down inflammation. He ended up growing back basically all of the hair that he had lost in 90 days. And that was a very unique situation because he was having an inflammatory reaction that was leading to this particular issue. We did not do anything for the DHT blocking because he was concerned about plausible side effects, but we did treat the inflammation, so we were able to grow back all of the inflammatory areas, and obviously the DHT areas remain. If you feel like you're dealing with inflammatory hair loss, there's a handful of symptoms that would confirm that, and then obviously action of the hair loss would also confirm that. So first and foremost, you want to look at the speed of the hair loss. If you're losing a lot of hair really quickly, and it's not just from the top of the head, then you're probably dealing with inflammatory hair loss. If there's itching, burning, pustules, If those types of things are happening on the surface of the scalp, it's probably inflammatory. And pretty much the thing that confirms it most of the time is if you are having gut issues, constipation, diarrhea, acid reflux, even in some sort of small way, whether it be just indigestion after a meal, that counts because your gut is directly related to how your immune system is going to act. And if you're dealing with any type of leaky gut or any dysbiosis in the gut, then it's going to possibly lead to inflammatory hair loss. So if you end up going through this, make sure that you know if it is in fact inflammatory hair loss. If you like content like this, please go ahead, subscribe to this channel. And if you've got questions or comments, please go ahead, leave them in the comments below. I'm happy to help in any way.